So we're going from Leonard Skinner to CCR on a Monday morning?
Why not?
Yes. I have no complaints. Glad to be with you. It's Mornings with Richard Cross on SuperTalk Mississippi. Lance, are you most proud that I was actually able to properly name two bands in a row without cheating?
You nailed it.
Yeah, there we go.
Very proud.
Thanks for joining us. C-Spire text line is open at 601-879-4395. We have our first guest, not just of the day, but of the week. You know her well, Dr. LouAnn Woodward, Dean of the School of Medicine at the University of Mississippi Medical Center, and a Vice Chancellor, and she's a doctor also. Good morning, Dr. Woodward. How are you?
Good morning. Good morning. So glad to be with you today.
Good to be with you as well. Can you pull the microphone?
Yeah, I'm sorry. That's my fault. I
you?
didn't pull the mic over for her. That was my
There we go.
I was too busy politicking. And
there
talking.
we go. Is this better?
That makes it better. We had you, but it was like you were off in a cave a little bit. So those microphones get in the way sometimes.
All righty. Glad to be here.
Let's start with a piece that you wrote recently. It was published on supertalk.fm and other places, an op-ed affirming that UMMC is not going anywhere. How in the world did we get to the point where you had to write this, or you needed to remind people that Jackson is home and we're not going anywhere?
So let me tell you, we recently opened and are building some facilities, clinical facilities in Ridgeland. And I think that is what kind of set off this narrative of, well, the medical center is leaving Jackson. Medical center's leaving Jackson. Now, we have opened clinics in lots of other places around the state and didn't get that same reaction. But I think, just the proximity or whatever, it just sort of set off this reaction that at first, I'll tell you, annoyed me because I thought, oh my gosh, look at all these things we're doing. And, somebody's focused on just this and making a with partial information, kind of making this story. But then I thought, well, maybe that's my fault that people have partial information. Maybe I need to really kind of put out a more complete story about some of the things that are happening. So, maybe shame on me for not doing that every so often, once a year or so, on what's happening at the medical center, because it's constant. We are expanding in areas around the state, all the time. And so for one or two things to really get highlighted as if that was all we're doing, just, is because I think people don't know. So it was in part a reaction, but then also really just a chance to think, this is something I ought to do. I need to get this out there and let people know what we're doing. You get you get tunnel vision in your daily work and the things that you're doing and talking about every single day, and you just kind of feel like, well, everybody should know this. This is all we're talking about.
Yeah.
But in fact, that's not. So it was a good opportunity, I think, to talk about a little, and you can only put so much in an article like that. You start out and it's way too long. You have to trim it back. But to try to touch on why we do things in certain areas, why some things are better to be on the Jackson campus and some things are better to be out in the communities. So a little bit about the why, but also just some of the plans that we have. We have, in the last couple of years, done a lot in Jackson and all around the state. But the bottom line, the point I was really trying to make, and just the real bottom line is we are constantly evaluating opportunities to expand in different locations, but we're also growing and expanding on the Jackson campus. And when I welcome new employees, typically on Monday mornings, if I'm not here on Monday morning, but typically on Monday mornings, I do a welcome to new employees. And the way I word it is the Jackson campus there at 2500 North State Street, that's the mothership. And it has been since 1955, and it will always be. That is the main campus.
Well, and it certainly is not uncommon for mothership medical centers to have affiliates or satellite locations in other places, but seeing the footprint grow to almost statewide, or maybe absolutely statewide,
absolutely,
is a little unique. Maybe I don't. Maybe it's not unique. Maybe that is a more common thing. But I'm wondering if that's where some of the confusion came from. We were like, well, hold on, UMMC in Grenada.
Where are they going?
The coast,
That's right.
Or
That's
in the
right.
Delta. Well, how does this make sense?
So there are a lot of states that have a larger population and more services, and in fact have multiple academic medical centers within the state. There are a few states that tend to be like us with a lower population, more rural, that have one academic medical center in the state. So I think that is one of the things that makes a difference. We are the only academic medical center in the state, and if an entity is going to have a clinic somewhere else around the state, for example, for patients to have some of their pre-op or post-op care around transplant, well, that's going to be us. So our state, we in fact do have a statewide reach when you look at our different services, whether it's telehealth or in-person patient services, or even the places where our students go out in the community to train. The different connections we have, in fact, touch all 82 counties in Mississippi. Yeah. We have a presence in every county in Mississippi. And it might not be that way if we were a bigger place and Mississippi had 2 or 3 academic medical centers, but we only have one.
Sure.
And so we try to do a lot of things to really address especially that rural population, and to have those connections all across the state. I mentioned this in my article, but I grew up in a rural part of the state, Carroll County. I was up there this weekend, made a quick little weekend loop through Carroll County, Grenada, and Oxford, got to see some people. But that's where I grew up, a very rural part of the state. And as you mentioned, I'm a physician, and I've worked in our emergency department, our adult emergency department at the medical center for 20 some odd years. And through both of those past experiences that have clearly shaped my life, I feel like I have a deep understanding of the challenges we have in getting health care out to all the people across the state. Right. In some of the rural parts of the state, it is just really a challenge to get transportation to get somewhere. So the more that we can extend our reach and try to meet people, out where they are, I think that's better for the patients.
Different but similar. I feel like sometimes UMMC's affiliation with the University of Mississippi is frowned on by some people. They're like, this should just be a standalone entity. It shouldn't be that Ole Miss has the medical school. What is the relationship between if we go back and use your term again, mothership, the Oxford campus, the Ole Miss campus in Oxford, with the Jackson campus of UMMC and that relationship and how it exists?
So it is established by legislation. By our enabling legislation at the medical center, we are a department of the University of Mississippi. So that is how it sort of came to be. The original component was a 2-year med school. So we started as a 2-year med school in 1903 that was housed on the Oxford campus. So really? Students would go to school there for 2 years, and then they would go for their last 2 years somewhere else, Memphis, Tulane, wherever. They'd go wherever they went. So in the 50s, the Mississippi legislature, in an effort to have ultimately more physicians in Mississippi, they felt like Mississippi needed a 4-year med school. And that the legislature needed to build a teaching hospital to go with the 4-year med school. So the decision was made by the legislators to move the med school to Jackson, establish a 4-year med school, and to open a teaching hospital. And that's what opened there at 2500 North State Street in 1955. And interestingly, in the process of this percolating through the legislative process, there was a House committee, and I don't know which committee it was, if it was education, if it was public health, I don't know, where the vote passed by a single vote. In fact, it was a lady legislator who'd been in a wreck who had to be wheeled in to cast that one single vote. So by one vote, in the Mississippi legislature in the 1950s by a lady, we are here on this campus and have this huge presence that we have. So that is sort of the structure. My boss is the chancellor. So Chancellor Glenn Boyce is my boss. And he and I work together very well. We've worked together for years, even before he became my boss in his prior roles with IHL and other things. But we work together very well. He is just as supportive of the medical center as he can possibly be. He is so enthusiastic and so supportive and doing a lot of work to help us with this cancer project. He tells people, and, this is when it's really sincere. He tells people when we're not in the room, even, that cancer is the top priority for the university right now.
Wow.
So he is extremely supportive, and we work together very closely, and even have a couple of joint programs that we share in pharmacy and nursing.
We will continue the conversation with Dr. LouAnn Woodward coming up in just a moment, Dean of the School of Medicine at the University of Mississippi Medical Center. And we'll talk a little bit more about that cancer project and where that is in terms of continued progress. Back after this with you on Mornings with Richard Cross. Mornings with Richard Cross, SuperTalk Mississippi. Glad to be with you. Dr. LouAnn Woodward is my guest, Dean of the School of Medicine at UMMC. Vice Chancellor at the University of Mississippi, and a still practicing physician, at least some of the time, when time allows for it. I want to go back to where we were before the break. You were talking about Glenn Boyce, and I feel like because of his leadership style, even though he's been in the position of Chancellor at Ole Miss for half a decade now, that there's still some mystery around him because he works quietly. He is not in the public spotlight all the time. Tell us about the way he operates as the leader of the university.
So I can tell you what I've observed, both with him in this role and then when I knew him before. He works endlessly. Let me just say that. He is he's one of those people that I'm constantly saying, I hope you're going to take this weekend off and get a little bit of rest. He works tirelessly and endlessly, but like you said, is a little bit more of the not necessarily just out he is not seeking the spotlight, maybe is the best way to word that. He is not out there making it about him and seeking the spotlight by any means, but he is just tirelessly, constantly working for the university, for the medical center, really for education in Mississippi as a whole. But he is collaborative, easy to reach, easy to talk to, does not try to micromanage, wants to understand what's going on, and then basically just wants to know, how can I help? So it has really been a pleasure to work with him this last, as you said, now half of a decade.
Yeah. It goes in a hurry. We were talking about the affiliation that UMMC has. And when I say affiliation, I mean it's part of the University of Mississippi. But
right.
it is unique in that students from schools all over the state of Mississippi come to the medical center, whether it's Mississippi State or Southern Miss or Alcorn State or Jackson State or any of the other schools within the state. That makes it a little unique.
It is. We take students from every single university, community college in the state of Mississippi, and even some outside the state of Mississippi. And we've talked before. Several of our schools require you be an in-state student, an in-state resident, but you could go to college out of state and then come back. But so we take students from all of the Mississippi schools and colleges, and we partner with especially the larger ones. I can't say all, but with many of the universities and colleges in the state in different areas like research, et cetera. So we have a number of research partnerships with other universities. I think being in that healthcare space, there's just a lot of synergy in different pockets with different universities. So we partner very well and happily with all the different colleges and universities both in the standpoint of research, as I said, and then through different student programs, all of which the Chancellor is very supportive. You know, he has never had the approach of, we only want you to work with us. He realizes the benefit of us partnering with others, you know, when it's a good fit and benefits the state.
The Cancer Institute.
Yes.
We have talked a little bit about this in the past with you and some of your colleagues at UMMC. You mentioned a second ago it's the initiative that you're most focused on. It is the initiative that Dr. Boyce is focused on. I think the legislature has taken certainly a big interest in this as well. Remind us exactly what it is that you are working toward, and then let's talk about how we're getting there.
So, and I kind of went over this a couple of weeks ago. I had it may have been now almost a month ago, you know how time flies, but early in his new term, we had the opportunity to sit down with our new Jackson mayor and kind of give him this overview. It's several-fold what we're doing. The ultimate goal is what's called NCI designation, National Cancer Institute designation, and that is a research-based designation. That is kind of the key that opens the door to becoming one of these cancer centers that are in that club that you think of when you think of those places that people go when they need that extra care, whether it's MD Anderson, UAB, Vanderbilt. All of those are NCI-designated cancer centers. As one of those,
and even, forgive me for interrupting,
No.
but even outside of this region where those places are so familiar, we're also talking about Sloan Kettering and Johns Hopkins and UCLA Medical Center, the elite of the elite nationally.
Right. So, and that NCI designation means that you have in your institution a certain sort of horsepower in research strength. And because of that, when you submit your application, if you are awarded that designation, you have access to clinical trials and other things that people who are not NCI designated centers do not have. So that's the North Star. That's what we are working toward. Now, in the efforts toward that achievement, there are lots of different things going on. And one of the pieces that probably people hear the most about is a facility, a cancer facility to bring all of our cancer services together, whether it's radiation oncology, whether it's infusion treatments, whether it's clinics or what have you, to bring all of that together. And we've got a large philanthropic campaign going on now. The projected cost of this cancer center is $250 million. And since we started talking about Jackson, let me be sure to add that the identified site is there across the street from our campus, next to the American Cancer Society Hope Lodge, right there between the medical center and the stadium parking lot. So it is on State Street, just on the west side where that stadium campus is right now, and the parking. But there's green space along there where Schimmel's restaurant used to be, et cetera, and that's the identified site. So again, a huge investment in Jackson. But the projected cost is $250 million. We have a fundraising campaign that's technically it's in the quiet phase, but I'm talking about it a lot. So I'm not.
If you want to be part of the quiet phase, we're happy to talk about it out loud.
I am not. I'm not really adhering to the rules of the quiet phase because I'm talking about it a lot. But we're in the quiet phase of that to raise $125 million. So to raise half of the funds for that facility. How far along are you? So we are at, as of about a few weeks ago, we are at $60 million.
Okay.
So the quiet phase so far has been very successful.
It's incredible stuff. I was thinking as you were talking about going after that NCI designation. Good grief, it's probably been 30 years ago now. But when Robert Kyatt took on the role as chancellor, he took on a pretty audacious goal from an academic standpoint of establishing a Phi Beta Kappa chapter at Ole Miss. And almost all of his decisions, or at least many of his decisions, we're informed by, does this help us get closer to that goal? Is this a similar chase?
It is. It is. You know, at the medical center, there are so many things that are going on, and a number of strategic priorities. Growing our transplant program, continuing to grow our pediatrics program. You know, these are all important strategic priorities. But at the top of the list, and where we are putting all the efforts, is that cancer. I mean, you just, you know, if you don't focus on these critically important things like that, you just can't line everything up to achieve that goal. And we intend to achieve that goal. I'm confident that we will.
Somebody wants to know if there could be a crosswalk in the future over State Street in the Woodrow Wilson area for the safety of students with all this construction you're discussing.
So let me just talk about that for a second, if that's okay, because this
Sure.
is people ask this question all the time. So the answer is possibly. It depends on. So first of all, you have to remember State Street is a U.S. highway. That's Highway 51. So that adds a little bit of complication. But if there is a building on that side of campus that it would make sense to connect to a building on the medical center side of campus, then that is a feasible possibility. Something that is possible. What we have learned and what we have been told, we've had in the past, and I can't speak for forever, but I can speak for about 20 years. In the past, we've had several we've had several traffic studies done on the campus, both vehicle, pedestrian, and wayfinding, all of those things. And in fact, we're about to kick off another one. But what we have been told in the past is that if it is a freestanding crosswalk, meaning on one side you have to walk up steps,
Right.
walk over, and then walk down steps, that people just won't do it. They will go under it every time because it's faster. So they've convinced us that would not be a good use of funds. But we are considering, would there be buildings?
Thought.
Yes.
Hold that thought.
Absolutely.
We'll finish up on the other side of the break.
Okay.
It's Mornings with Richard Cross. Dr. LouAnn Woodward from UMMC is my guest. All right, so we left it off with a walkover on State Street. If you build it, they may not necessarily come. But if it's attached to two buildings, then it is a very real possibility. Just a couple of minutes left with Dr. LouAnn Woodward. Always enjoy the conversations and appreciate your time. One of the things that we've not talked about this morning is your role with the legislature. And we are in a time where the debate over Medicaid and Medicaid funding seems to happen year after year after year. Much of the funding, or at least a significant amount of the funding for UMMC, comes through allocations from the legislature. Where are you in terms of your relationship with the elected officials in the Capitol?
So, yeah, our relationship with the state legislature and the state leaders and members of the legislature is very important. It's a very positive relationship. We get about 10%. It varies just a little from year to year. Sometimes it's 9, sometimes it's 11. But, for walking around numbers, the easy number to remember is 10% of our funds come from the state, and we funnel those to the schools and to the research mission. So, our current CFO and CFOs in the past have said things along these lines, that research and education are great missions, but they are bad business plans. But we enjoy very strong support from the state, and thankful for that. And as you know, we've got a nursing school under construction right now, a dental school under construction, and those were special projects funded by the state, which we are very grateful. I am in conversation with them about supporting the Cancer Center, because I think that this is something so important to the state of Mississippi. This will support all the citizens in the state and be a referral entity for all the other healthcare entities in the state. So I'm speaking with them about supporting us in this cancer journey as well.
Is that like an allocation of special funds, a one-time thing, or are you looking for an increase in the annual give?
So some sort of special allocation, whether it is a one-time appropriation or spread out over several years. That is typically, at least from my standpoint, the way I understand that, they would support a special project like this. They supported the children's expansion when we were building the Sanderson Tower, so they supported that tower with some funds over a couple of years. And we're speaking with leadership coming up and have been speaking with them for several years as we have kind of ramped up to this. I have, in all of our appropriation meetings the last few years, I have said to them, this isn't the year, but coming up soon, I'm going to come back to you and ask you to support this cancer program. So this is the year that we're going to make the ask and hopefully get some support. They have supported us in a cancer appropriation for a number of years, and I feel like this is the next step, and it would really, I think, be a boost to the entire state and the entire economy of the state to have this in place. And certainly our federal delegation that really live and work with NIH and know what these institute designations mean to a community and to a state are very enthusiastic and very supportive. So we're hoping to see that same level of enthusiasm from our state leaders.
I was just thinking with a project this massive, it's so hard to spend the money and it's hard to raise the money. But once you get to the finish line of the project, has anybody ever looked back at the children's expansion and go, man, I wish we hadn't done that?
Oh, my goodness.
It's like people are so proud of it, and it's like it hurt to get there, but.
And I think our biggest cheerleaders in that space are the pediatricians around the state who send their patients to us for whatever level of expertise they need, and then we send their patients back. We are not in this space to shut down anybody else who's taking care of cancer patients. We need more, in fact, people taking care of cancer patients around the state. But we can add that expertise that they don't have. We can add the research component, the clinical trials, and, of course, the training component. I mean, that's critically important. So we're excited about this and excited about the possible expansion, too. 60
seconds left. What's on your to-do list?
Make it all happen. Make it all happen. Get us across that finish line. That's it.
Maybe UMMC needs to be buying Powerball tickets. It's up to $500 million now.
Maybe so. I could use $500 million. Let me tell you.
Would go a long way. Always appreciate your time, Dr. LouAnn Woodward. Thanks for joining us in studio this morning, and wish you continued success.
Thank you for having me. Appreciate it.
Mornings with Richard Cross, Super Talk, Mississippi. That's going to do it for us in the 7 o'clock hour, but we have an hour remaining with you. We're going to explore this relationship that the United States has developed and is developing with the largest chip maker in the world, NVIDIA. And then AI privacy concerns. Whoever could have seen this conversation coming? Thanks to Dr. LouAnn Woodward for joining us. A lot of good stuff happening at UMMC, and a lot is on the way. We'll keep an eye on that and continue to visit with her and others from Medical Center about progress and expansion and growth and all the good things that are happening. Glad to be with you this morning. It's Mornings with Richard Cross, Super Talk, Mississippi. The news is next, then 8 o'clock hour. Stay with us.